So, one of the concerns that patients have is that almost always when you talk about a laser, people get a little bit, I wouldn't say afraid, but they kind of associate that with something that's going to be very aggressive and severe, like the CO2 laser that's going to create a lot of downtime and stuff like that. And that's one of the things that I want to clarify, for you, which is that, back several years ago, before, the laser technology and the delivery mechanisms and all were not as sophisticated, and, doctors frankly didn't know any better, the treatment was extremely aggressive and really created, significant injury to the skin, temporarily, that heals with scabbing and swelling and redness and all that. It did give a good result, but it took a lot of time to heal. However, with the improvement in the technology, we now have the ability to set the laser at various different settings of different degrees of intensity and energy levels and all kinds of things that can modulate the aggressiveness of the treatment on the skin. So the downtime is different for different people based on what the patients need. And so a conversation with the patient always helps to kind of understand, the motivation, the pain tolerance, their lifestyle, whether they're able to have a few days off at home, they have to get back to work the same day or the next day, and that's how we really determine how aggressive to be. And the better treatment nowadays, anyways, is to really give patients the option to do what we call combination treatments that use multiple different types of devices that do different things and work at the same time, at the same setting when you do the treatment. So over the course of healing, they're all working together. And that's a better way to manage somebody's skin than just blasting them sometimes.
And with the laser, then, what do I expect to see? Like the tightened skin, right? The fine
So,
lines.
this specific laser, I mean, I think it's good for patients to really understand. This particular laser, which is a CO2 laser, is what I'm using, carbon dioxide laser. It essentially, you can think of it as a pressure washer, on the driveways, because it essentially peels off the surface dirt on the driveway, right? With the force. This with the laser does somewhat similar. So it doesn't penetrate deep into the skin. It basically peels off the surface layer of the skin, and then if you want to do more, you go do it again and go a little deeper to see how deep you want to go. So in this particular case, I am treating the very surface layer, and so this is going to kind of make that skin essentially peel off somewhat, and then new skin is going to grow, and that skin is going to be much healthier looking. So the new skin will have a healthier look to it. It'll be tighter, it'll be softer, it'll be smoother, and it'll also improve the fine lines and things like that.
And shrinks the pores?
And yeah, the skin has, we all know, has a lot of different types of glands and structures and stuff. And this laser, since it's basically indiscriminately treating the surface layer of the skin, everything in its pathway has to regenerate essentially. And therefore, the same thing for the pores too, because the pores can also, reform or regenerate, and they can shrink and function much better.